A blood buddy for Namibia. A large country and a young one where blood buddies help to save lives. Today it's a morning off classes for learners from Centaurus School. But it's in a good cause. Several Windhoek schools have turned out to celebrate the gift of life on World Blood Donor Day. Learners from 45 schools in Namibia donate blood.
World Blood Donor Day.
The message is loud and clear. Giving blood can save a life. Today's march is a thank you to blood donors, learners, soldiers, workers, managers, everybody who gives blood voluntarily and without payment. And the Blood Transfusion Service of Namibia has something to cheer about too. All blood is screened and safe for use by Namibia's hospitals. Once you have reached 16, you can give blood. World Blood Donor Day is a wake-up call to new donors, because blood is always needed by Namibia's patients. Safe blood, saving lives. It's a message the medical director of the service is proud to repeat.
The theme of World Blood Donor Day 2006 all around the world is, and I quote, universal access to safe blood. And this is a goal to which the BTS of Namibia or the Blood Transfusion Service of Namibia is totally committed to. Can we now all say together, I save lives, we save lives, and we do this 20 times. 1, 2, 3. I save lives, we save lives. I save lives, we save lives.
I save lives, we save lives.
Saving lives can start in Independence Avenue, Windhoek, one of many centres and mobile collection units where blood can be donated. Donors can pop in at any time without an appointment. It only takes 20 minutes. Vaino Nagonga is a student. He's given blood 12 times already. The donation is less than half a litre, which is soon replaced by the body. In fact, you can give blood up to 6 times a year, and it's actually good for your health.
Thank you very much.
After a juice and some biscuits, the body starts to replace the blood. Vaino reflects on the idea that he's giving something back to his fellow Namibians.
If I don't donate, I feel so guilty, because God gave me this blood to give. To save lives is also good, because I feel so great to save some people's life.
Vaino's blood is on the way to the lab. The Blood Transfusion Service of Namibia uses the latest equipment, and the staff of nurses and medical technologists are trained to the highest standards to screen the blood to make sure that it is safe and no infections can be passed on to patients.
What the Blood Transfusion Service is all about is to ensure that what comes out of the service is safe blood that would not infect anybody else with a pre-existing disease in the donated blood. And we always try and ensure to actually have first-class medical technology available, and this is the way the blood is being tested before it is being given out to the patients. It is likewise important to make sure that the personnel is constantly upgraded with regard to their knowledge, with regard to their training, that new people are being trained that can ensure continuity with regard to the services that the BTS is rendering. And I think, taking all this into consideration, we're very proud to say that we have got extremely safe blood, which is comparable to any first world country, and we've always been in the position to supply enough blood wherever and whenever it is needed.
Sister Judith is the nurse on call-up duty, reminding donors about tomorrow's clinic.
Mr. Okena, this is Judith. I'm calling from Blood Transfusion. How are you this morning? I'm fine, thank you. This was just a reminder about tomorrow's blood donation clinic. There will be a team in Okahanja between 11 and 5:30. Will you manage to make it then? Thank you very much, sir. We'll see you then tomorrow. Bye-bye.
All of the donors are volunteers. People Judith knows have healthy lifestyles. While Judith is on the phone, in the lab downstairs, the samples from yesterday's donations are being tested. First, a drop of blood is mixed with a saline solution. To the naked eye, all blood looks the same, red. But humans have 8 different blood groups. Droplets are added to reagents to find out what the blood group is. But some patients can only receive blood from a donor with the same blood group as themselves. So finding out which group the blood belongs to is critical. It doesn't matter whether you are white or black. It is only your blood group that is important. Group O is very useful, as it can be given to all patients in an emergency. Next morning, it's all go. Cold packs are made ready for the safe transport of blood. The mobile blood donation team is packing for a trip to Okahanya. Other teams are bound for schools, shopping centres and workplaces. The teams spread out, holding 88 clinics a month, collecting thousands of blood units every year to supply the Ministry of Health and Social Services and private medical practice. The cold packs in the vans are the start of a cold chain which will keep the blood safe and ready for emergencies throughout this vast country. Okahanja is a small town, but every blood unit can save a life, and every donor is welcome.
On behalf of the nation, I am inviting you to come and donate some blood for us today. And the place where you can come for blood donation is at the town hall, whereby we have started with our blood clinic, and we are going to be there now on until exactly 5:30.
Most of Judith's regulars are here. Mrs. Robke is a lifelong donor. Charles is here too. The first thing to do is fill out a form, so Charles helps a new donor. It's a friendly atmosphere.
They are friends, really. They are friends, really. Because the way their commitment to the issue of donating blood, apart from they are voluntary, we don't give them anything. So you call them, they've got that effort, they leave what they do, their jobs and commitments at home, and they make time to come and donate blood.
A pinprick produces a drop of blood, enough to test the hemoglobin level in the red blood cells. Those are the ones that carry oxygen around the body. If the level is too low, it's best not to donate. Judith takes a blood pressure reading, then checks through the information Charles has provided on the questionnaire. It's important to be sure that donors are in good health. Mrs. Rupke has already made her donation. The donors are always offered a snack and a drink. Charles doesn't think donating blood is anything special. It could be himself or somebody else who needs that gift of life after a traffic accident. He thinks more people should become volunteers.
I'll tell them, you save your life and you save another person's life. Simple as that.
After a juice and some biscuits, Charles will be back at work. Every drop of blood counts. Today there's an emergency. Blood donations from Okahanya are urgently needed in Windhoek. The Namibian operation sets a good example to the rest of Africa, according to the World Health Organization.
You know, in the African context, only, I would say, 25% of countries are promoting the voluntary non-remunerated blood donation. And you know, in Namibia, it's happening 100%. And in the era of prevention of HIV/AIDS, the screening of blood is extremely important. And Namibia is doing it 100%. So I would say really Namibia is doing very well in terms of performance, 100% non-remunerated blood donation and 100% screening. That's what, as WHO, we are advocating for.
In rural Namibia, especially in the north, the medical services are often strained to capacity by malaria epidemics. Blood transfusion is an important part of malaria treatment, and that blood has to be free from infection and always available. The Ministry of Health and Social Services can rely upon the blood transfusion service of Namibia.
Malaria is one of the public health problems in this country. You are talking of anything around 1,400 deaths due to malaria on an annual basis. The pregnant mothers, expecting mothers, and children, especially the under 5s, are heavily infected. In the process, they suffer from anemia. How do you control anemia? The major tool to control malaria is to supply blood to the patient. Where do you get this blood? You can only get a authentic blood from Namibia Blood Transfusion Services, where at least you are guaranteed anything around 99.9% statistically. You are rest assured that your blood at least is free from HIV infection. And secondly, that your blood is free from hepatitis B.
On World Blood Donor Day, the World Health Organization gives thanks to donors who contribute so much to the nation's health.
Safe blood transfusion is one of the key medical interventions in healthcare delivery system. And we know that the majority of patients that need blood transfusion are usually mothers. Any of us can become mothers. I am already, and almost grandmother, who develop complications during childbirth. Other cases are road traffic accidents, surgical procedures, and many other conditions that need blood transfusion. Unfortunately, blood cannot be manufactured in a factory, cannot. It can only be obtained from willing volunteers who are willing to share their good health with other people in need.
Many dedicated persons are involved in ensuring a safe blood supply to the nation.
The need for blood is universal, but access to blood for all those who need it is always not. Too often, we take it for granted that there will be regular supply of blood for transfusion in hospitals should we need one. And we forget that behind each transfusion service lies a well-run network of health professionals, laboratory staff, donors, and others to ensure that blood supply is available and safe.
Providing safe blood when and where it is needed is the mission of the Blood Transfusion Service of Namibia. In this centrifuge, red blood cells are separated from blood plasma. Modern transfusion methods use only the parts of the blood needed for effective treatment of a particular patient. Most of these so-called blood products are separated from donated blood at the laboratory in Windhoek, ready for use in Namibia's hospitals. Blood platelets are used to stop bleeding after an injury. Plasma is the vital fluid which carries blood cells around the body. But for transfusions, the most commonly used blood product is concentrated red blood cells. Nothing is left to chance. The blood bags, questionnaires and test tubes all have barcodes attached to identify them. And when blood is needed, it is ready for use. Patients will never know who donated the blood, but they will always be grateful.
The BTS is something that the Namibian nation can be proud of, and it is very important to actually thank our regular donors and new donors who, selfless and without any self-interest, actually donate blood, make available that so-called gift of life.
Why do I give blood? I give blood to save lives.